Here in the Dr. Steve Show, we're helping you find the fountain of youth. No matter what your age, everyone really wants to have great skin. We're constantly searching for trends in anti-aging treatments so we can bring you the latest developments to let you know if they really work. Well, with so many options out there, sorting through it all can be pretty confusing. So we turn to an expert to break down some of the most popular non-invasive cosmetic procedures around.
My skin was starting to look very wrinkled. I had spots from the sun, damage, and also I suffered from rosacea.
At 56, Debbie Rogers doesn't feel old, and the New York mother certainly doesn't want to look it.
I had a deep furrow in my brow, and that was just a sore spot with me. So we decided to use a filler.
After noticing the signs of aging at 50, Debbie sought out solutions to smooth out her skin.
We did a Fraxel laser resurfacing, which greatly improved my complexion, both with the eruptions of blemishes and some of the scarring and superficial lines.
The method of combining non-surgical treatments is often referred to as a liquid facelift.
They call them liquid facelifts, they call them stem cell facelifts, and the reality is that a facelift is a surgical procedure with pretty excellent results that are predictable. We do facial injections all the time, but we don't call it a liquid facelift because it's not a facelift. You're filling up lost volume.
Dr. Lawrence Glickman of the Long Island Plastic Surgical Group says if you want to turn back the hands of time, there are plenty of affordable and non-invasive options, like lasers, which not only remove blemishes, spots, and discoloration, but can also blast away wrinkles.
Certain lasers will adjust or change or modify the texture. You can have fine wrinkling, you can have deep wrinkling, and you can have furrows. And we have a special laser which is used for tattoo removal, which can also remove brown pigmentation.
We've all heard of Botox, which paralyzes the muscles to smooth out lines and wrinkles. But if you need to restore youthful fullness to your face, consider fillers.
If the problem is a furrow, then you don't want to paralyze it, you want to fill it. We use Juvederm or Restylane or Perlane. We use Radius, which lasts a little longer. And there's some other products, one that's called Sculptra, which actually lasts for several years.
And then there's fat, where the patient's own body is used to replace lost tissue.
That's more of a procedure. It takes longer. It costs more for the patient. And we have to process the fat and inject it. But the fat that survives is permanent.
As for Debbie Rogers, it was a combination of treatments that gave her the confidence back. And she says she couldn't be happier.
I feel better. It gives me a more confidence and self-assurance.
Up next, from me to you, a delicious doctor's orders.
This portion of Dr. Steve is brought to you by Long Island Plastic Surgical Group, providing excellence in plastic surgery for over 60 years.